This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
We had a group of system chief quality executives that came together and did some research on quality competencies. We also looked at leadership attributes, and it was clear to the group that quality does not always have a seat at the table. It's very, very important for quality executives not to sit on the sidelines and have a seat at the table.
Welcome to Sg2 Perspectives. I'm your host for this episode, Jayme Zage. We at Sg2 recently published an analysis on quality and its impact on health systems resilience. I thought this was a topic that our Sg2 Perspective audiences would want to hear a lot more about. Guests today are the authors of this report, Maji, who is a principal with the Sg2 Intelligence team, and Jodi, Eisenberg, an associate vice president and leads our quality executive network. Together, they created this analysis, and I'm excited to have them both here. Welcome, Jodi and Catherine.
Thank you for having us.
Thank you.
There's no doubt that quality is important, but let's start the conversation by discussing why we embarked on this particular analysis, looking at quality and resilience, sustainability, those concepts in the report. Why is it so important now?
We all know that quality is non-negotiable, and it has always been a core clinical and operational focus for health systems. But the industry is now facing a lot of pressures like margin compressions, workforce constraints, payment pressures, and ongoing M&A activities. Quality goes hand in hand with access and capacity, which are two of the biggest pain points that health systems facing today. These challenges cut across the whole system of care. It's not just in patient settings. They impact how organizations think about strategic growth, sustainability, and also patient experience. We all have more data and information readily available as consumers and more choices in terms of how we manage our health and also where we receive care. There is a real convergence of strategy, cost, and quality when it comes to health systems executives' decision making. Does that resonate with you, Jodi?
Absolutely. When we looked at the research and the data, it drove us to the conclusion that quality isn't just this regulatory imperative. It is the strategic lever, especially given all of those pressures that you talked about. It's a way for organizations to move from keeping their performance up with today, but also sustaining that performance into the future. When we think about quality has always been a priority. Why now is it not just table stakes, but actually a strategic lever? For years, quality leaders have been the people in the background saying quality drives value. This research helped us to look at that assumption and look at it against financial data. Quality executives and CFOs and COOs are all working together to drive access and capacity to the system, to the care. They're driving access and capacity to the right pharmaceuticals, the right supplies, the right workforce. And so this thought of quality as a strategic lever allows organizations to pull together quality finance strategy as integral pillars to sustainability. And quality is right in the middle of that convergence of factors.
You bring up some interesting perspectives. It's not just this table stakes, non-negotiable that you just have to meet. It's a requirement to be part of the game. I was definitely an advocate when this research was starting to say quality is not a differentiator. We talk about differentiation, but it depends on how you're differentiating yourself and who you're differentiating yourself to. In the report, you do a great job of laying that out. The other thing that you do in the report is talk about different personas. Why is it important to look at this in that regard? And what are those different personas that you evaluated as part of the research?
This is exciting findings that we conclude. So part of the research that we did was to look at health systems that are already on the quality journey. organization in different part of the journeys, but we look at it through a strategic decision-making lens to prove the point that quality is a differentiator strategically. The personas or archetypes in the report emphasis that the goal for us to do this is not to label organizations, but to help organizations quickly assess where they are on the journey and where they want to be. We identified 4 different personas: trailblazers, insights leaders, impact laggards, brand riders, and upstarts. Across all these archetypes, we see meaningful differences in outcomes, driven first and foremost by how quality is being positioned and led at the CEO level.
As we look at and we report on the archetypes, there are organizations who don't fall into just one. When you look at a large integrated delivery network across their system, especially now as these systems, after years and years of merger and acquisition, and we're still seeing that, they're trying to find stability. Well, they may have stability at one point in their system, but as all organizations are growing the ambulatory side of business, they're seeing a variety of those archetypes. When I think about the archetypes and their impact on quality outcomes and sustainability, you've got those strong organizations that just by hearing their name, they're associated with quality. That says there is likely a component of culture that exists in that quality as identity. The culture, not necessarily the individuals that they've built up over time in their brand, drives their performance. It helps them to make their system resilient, not only to performance, but about the workforce. I'm thinking about some specific organizations who, even through the pandemic, were able to sustain performance and their workforce stuck with them. That didn't happen with every organization. That solid quality as an identity, as a system who begins to grow, has a big impact on the larger organization as they shift and grow and have mergers and acquisitions. When you think about the emerging organization, they've got some early improvements. They've got some areas where they're building formal structures. Maybe their outcomes are consistently below benchmark and they've got high variability. So they've really got to focus in on how are they going to bring cohesiveness across quality, finance, strategy, workforce, all of those pieces so that they can bring some long-term viability to their organization and to their performance.
We talk about the fact that quality outcomes at the enterprise level is a multi-year journey. Having real-time, more current data to track performance and benchmark progress can actually accelerate that journey.
Thank you for that in-depth look at the archetypes, but what's important about them and how they continue to move forward. We've briefly mentioned the quality and accountability piece, and Jodi, give us a quick overview of what those domains are in the quality and accountability rankings, just for anybody out there who's not familiar with them.
Vizient Q&A domains are focused on 6 critical areas, which are looking at healthcare performance across the continuum. The first is mortality. It's looking at the overall risk of death among patients in the organization. Efficiency. How efficient and effective are the patients getting the care that they need? Effectiveness, that assesses the quality of care provided. Safety focuses on minimizing harm to patients. So think about hospital-acquired infections, patient safety indicators, those things that present harm inadvertently, those things that we are all working in healthcare to prevent. Patient-centeredness, that really measures the alignment of care with patient preferences and value. And finally, variations in care. This was recently changed, looking at disparities in healthcare. Every patient that presents should have access to a consistent level of care, regardless of where they live, what they bring as far as resources. We should be providing equitable care across the continuum.
That's really important. When I first started doing this kind of work at SG2, the concept of quality was very narrow to me. So it's good to understand it is a very broad term. When you look at these domains, and I don't know how deep your research went, which domains are the most important for that financial resiliency? Is there, we need to work on these for the financial resiliency. We need to work on these domains for workforce resiliency. Anything that you can add in terms of the importance of how these domains tie to that resiliency that you uncovered?
Which domain or which quality matrix will actually impact financials. We start our data analytics through that lens. We then took a different approach. When we roll the data up to quintiles, we started to see the patterns. And what we saw was meaningful differences between top, middle three, and the lowest quintiles across key financial metrics, including operating margin and also average commercial rates as a percentage of Medicare. That gave us the confidence and the excitement to continue the work. Just like quality is a multi-year journey, we are finding the relationship between quality and also financial impacts will continue at Vizian.
Depending on what executive at the C-suite level you ask, you'll get a different answer. That's where we as leaders in healthcare need to do a good job at identifying the right data that will help us tell the story in a solid way. It's interesting when you talk with quality executives and finance executives, some of the quality return on investment, ROI, is viewed as fuzzy math. When you look at both sides, one of the things that quality executives today are trying to do is to focus on how can we show our partners across the C-suite that there is true return on investment. When I think about of those domains, they're all important. But where am I going to see that direct connection to the financial bottom line? The efficiency domain is probably one of the highest in my mind. That's where you're going to see data related to length of stay, throughput, so access and capacity, utilization, labor. Improvements to efficiency are going to show up quickly in your financials. We want people to come to the hospital, to our ambulatory areas for healing, for preventative care. We don't want to make them sicker. So we want fewer adverse events. If we have fewer events, we're going to have less added cost. So think about never events, readmission costs, penalties from payers. And then some of those that are strong probably have a more direct ROI, but we need to focus on making sure the data is telling us what we need to. Improving the outcomes, show the outcomes, actually demonstrate our reliability of care. One area where folks struggle with is mortality. We're talking a lot about inter-hospital transfers. And the result that happens when a patient who is actively dying at a rural community-based hospital and they get transferred to the AMC and they're basically going to die. How do we ensure and work on the conversations that need to be happening way before they get to that stage of actively dying? My top two would be efficiency and safety.
It's important to understand, too, that they're very intertwined. The data component we haven't really talked about, but that's certainly critical. Thinking about that infrastructure piece for this journey, of which I would argue you never actually finish. It's all about continuing on that journey. Jodi, you also mentioned some of the other infrastructure up front in your introduction, and I'm curious about the leadership piece because we've talked about finance, we've talked about the strategic imperative, and when we think about which leaders need to be involved, how do we get them together to elevate that strategic imperative of quality?
I lead the Quality Executive Network. We had a group of system chief quality executives that came together and did some research on quality competencies. We also looked at leadership attributes, and it was very clear to the group that quality does not always have a seat at the table. It's very, very important for quality executives not to sit on the sidelines and have a seat at the table. The leaders who absolutely must actively be involved, obviously your CEO. The CEO is the leader that models the expectations, helps his team, her team understand that shared purpose, holds people accountable, and really strives for that sustained improvement. The CEO team, the CFO, the COO, so the operating officer. In many cases, you've got the chief medical officer, and the chief nursing officer is often sitting at the sidelines with quality. Chief nursing officers manage 90% of the workforce. They must have a seat at the table. And the board is the ultimate accountable group. The CEO is the strategic integrator, and they've got to drive that quality work. I'm going to talk again about elevating quality. The quality through those leaders means embedding that into everything the organization does. Think about your capital process. Quality should be a consideration in that. Your growth strategy. The chief strategic officer should be working side by side with the quality officer to understand what do we need to do to ensure that we continue on that growth trajectory. Workforce, the chief HR officer, they're going to be embedded in that quality process. And then think about all of the changes that we've seen over the past several years related to technology and AI. We need to make sure that quality is embedded in that process, that we're not just laying over a new technology to something old that doesn't work, and yet we have no governance or no ability to take it away if it doesn't work. In my mind, you've got a core group of people that need to sit at the table, but quality, the process, needs to be embedded in everything you do in order to get to that point of improvement and sustained improvement.
Agree with you that this is a CEO-led mandate, and it is the single most important success factor. And CQO needs to have a seat at the table for all the decision making. But very importantly is the timing. It has to be done early. We heard repeatedly during our interviews is that once organizations are already make the decision, especially M&A integrations, it can be too late to correct any quality integration. We are not talking about single organizations' quality metrics. We are talking about enterprise. How are you going to have the quality standard at the level that you want to be across the whole system of care and all through your enterprise? In addition to the CFO, CEO, and CMO, Jodi also mentioned CSO, the strategy. And strong ongoing collaborations between CSO and CQO is very essential as well. We have done a number of client interviews, and the way we do it, basically have the strategy department, strategy leaders, and also our CQO sitting together. And we saw that the top performers demonstrate to us they have good collaborations, and they can give us examples of how they work together seamlessly on a really regular basis.
Jodi, Catherine, I think that integration piece of the leadership, that infrastructure, that embedded culture from frontline all the way up through the board is a great place for us to end our conversation. And for our listeners, what I want you to take away from this is quality is strategic just as much as it is how you perform in the patient experience, the access, the outcomes. It is everything that you do. And it's an ongoing journey. It needs to be multi-year. It needs to be continuous improvement. And it is that culture that really separates. It's not about meeting the benchmarks. It's about the embedded culture that is always looking to do something better. So with that, thank you, Jodi and Catherine. I appreciate you sharing your insights and your expertise. And thank you to our Sg2 Perspective listeners.
Thanks for listening. If you like this episode, please subscribe, rate, and review us, and/or follow us on Twitter and LinkedIn at SG2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, SG2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You could find them at Vizient /podcasts. Have a great day.